Hi, I'm Meg.
I'm Jill.
And I'm Megan Lynn. We're here at the AAFE Training Center today answering some of your most asked questions about PDO threads.
Here we go. Where can PDO threads be used? PDO threads can be used virtually anywhere as long as they're placed in the correct plane and you're placing them within your scope of practice. So for dental professionals, that is head and neck. For medical professionals, you can place it on the body. We're loving them in areas like the temples I like them for my acne scars in my temples, or for temple hollowness, or around the corners of the mouth for crepey skin. We're loving them in the neck for necklace lines. There are a million indications for PDO smooth threads, lifting threads we're using in lots of areas in the face and neck as well.
Okay. How safe are PDO threads? Incredibly safe. So because it's such a thin, fine filament, it's not going to fill up a lot like we would use in, other cases when we're using fillers. So we love using them in like the glabella area because it's basically as thick of a piece as a piece of hair. So they're incredibly safe, again, as long as they're in the correct plane. And then you also have less risks of bruising. They're very comfortable for the patients. So they're absolutely an incredibly safe method to use for filler or for just creating better collagen.
And certainly always, as long as you're in the proper plane. If your thread is too deep, you're running the risk that you're close to some vessels that you're trying to avoid. So certainly always use precaution. You should be absolutely trained before you implement any sorts of threads, either lifting or smooth threads, into your practice. So, they are very safe, but you absolutely need to be trained on the use of them before you use them. Alrighty. How long does it take to see PDO thread results? So that's a good question. So there's two different types of PDO threads. There's smooth PDO threads, and those tend to be more of a progressive result. So when we're treating acne scars, or maybe even volume loss in the temples, or perhaps submental area, this is more of a progressive treatment. So we generally require treatment every 4 weeks for 3 months, and then we give you a bit of a break and sort of let that collagen really take over. So max collagen production is 3 to 6 months. So with smooth threads, it's definitely important to set realistic expectations with your patients, to be patient. They're not going to see results right away. In terms of lifting threads, you will see immediate results and it will improve with time. So for lifting threads, you'll see that immediate lift, and then again, as the thread dissolves over time, neocollagenesis takes over, and that 3 to 6 months is really going to be your sweet spot for those lifting threads.
Can PDO threads treat acne scars? Very appropriate that I got this question. We were just talking about how I have had acne my whole life, from the day, even before I turned 12, up into adulthood, my early adulthood. My biggest problem area are my temples on either side. In my wedding photos, I hate anything that's of my profile because you can see just these huge acne scars. And we decided to treat them with PDO threads. So I had 4 consecutive treatments, each spaced apart at 4 weeks. And I've had really great success. The act of placing the threads subsidizes that scar tissue and breaks it up. And then it's replaced with that new collagen growth, which is super important. I've absolutely loved them for my acne scars. It's been a real game changer for me. I'm not caking on as much makeup in that area. We treat a lot of patients for acne scarring through their cheeks as well, so it certainly can treat acne scars. It's one of my favorite treatments for acne scars.
And we look perfect now. How long does a PDO thread treatment take? It kind of depends, so that's the short answer. So it depends on how much area we're doing, and we'll start with the case of just temples. The treatment itself is probably only going to take about 5-10 minutes. We'll get you numb first topically, and then if it's more of a full face, or we're doing like neck, a little bit longer just to get them in. So each thread just takes a matter of seconds to place, but it depends on how many we're doing. So if we're doing a big area like the cheek that we might be kind of cross-hatching, and say we were doing 20 or 30 of them, it's going to take longer than say if we were just doing 4 or 5 up there. And then when it comes to the lifting threads, that's going to take a little bit longer as well because we place them in a different manner. So first we go in and get that area nice and numb with lidocaine using a special technique, and we use special cannulas just to get into that correct plane, and then we go and place the thread. So the short answer is it really depends, but ultimately it's probably going to be anywhere from, if it's a simple treatment like Megan and her temples, 5-10 minutes. And then if it's like a more invasive treatment, we're doing multiple lifting threads, say maybe 45 minutes or so. But ultimately not too long, and then patients are very comfortable through it.
Who is a good candidate for PDO threads? I would say anybody. So as Megan said, you can use PDO threads anywhere. You can really find any indication to use PDO threads. So we've already discussed acne scarring. It's also great for areas of volume loss. So as we age, we lose volume in our temples, and this is a nice progressive treatment rather than putting filler in that area. It's also great for people who have very deep static wrinkles that maybe Botox isn't treating. Lifting threads. So candidates for lifting threads are those who maybe have that like pre-gel forming, or they have a nasolabial fold or a marionette line that really bothers them. And, you know, we always find the patients that come to the office and they're like, if I could just look like this, you know, and they're pulling their face back. If they're pulling their face back and envisioning what it would look like, then they're probably a good candidate for threads. Now, it's important, you know, patient selection is important. So you don't want to select a patient who has really, really heavy tissue, or, you know, maybe they've lost a significant amount of weight and the tissue is just very excessive. You know, we have to think we're lifting with a thread here. So it's not like an operative procedure or anything like that. It's literally a thread that we're trying to lift this tissue with. And so you have to set realistic expectations. But I think that like 40 age group is perfect time for lifting threads, just before things really start to become more obvious. They're going to have the best success.
Definitely. Who can legally offer PDO thread treatments? You have to have gone through a certification course in order to offer PDO thread treatments. And in order to go to a certification course, you have to have some type of medical license. So in the majority of states, registered nurses, nurse practitioners, PAs, dentists, and medical doctors are able to offer these. There are a few states in the nation where estheticians can do this, but they're very common. There's less than a handful. So we definitely recommend researching your provider and making sure that they do have a proper license and that they're allowed to do this in the state that you're in, and then proper training as well.
How long do PDO threads last? So the lasting results are coming from the collagen stimulation. So in a way, kind of indefinitely, but of course as you age, you're losing collagen regardless. The PDO starts to break down in about 4 weeks or so, with the peak collagen around the 6-month mark. So when it comes to the smooth threads that we're repeating, and we like to repeat them about every month, you start seeing those really great results about 6 months later. So say we were doing acne scarring, you'll see the real benefits peak at the start of the 6-month mark, and then depending on how many you repeated. But ultimately, those results just kind of get better as we go. So it depends on if you're doing smooth threads or lifting threads and how many treatments you're doing. But again, the most important take-home message is that the peak results are 6 months after, and that's when the neocollagenesis is really taking over. And then you'll get those peak results. And then you lose collagen just like you would normally lose collagen. So after age 50, we're losing 50% as we go, and so on and so forth.
And the lifting threads, they can last up to 2 years, but usually at that year mark, we're recommending coming back in for maintenance. As Megan said, we're aging. Although we've stimulated that new collagen in the face, we still continue to age. And so in order to maintain, we usually recommend about at that 12-month mark to come back for repeat lifting threads.
And often it sometimes will wind up wanting a lifting thread in a different place. So maybe we did lifting threads to lift here, but a year later, you might need a kind of different angle or a different maybe jawline lifting threads at that point, just because you've aged another year.
Can PDO threads be used on a patient with filler or Botox? Yes, they can. Certainly, this will dictate the order in which you treat the patient. So if you're doing PDO threads in Botox, you probably will place your PDO threads first and then complete your visit with the Botox. Just think we don't want to risk any migration of toxin anywhere. So if we're treating, for example, radial lip lines with Botox, but we're also doing vermilion border lip threads, If you were to place your Botox first and then place your threads, you're risking that chance of moving the Botox somewhere we don't want it. Same with filler. I generally don't like to fill on the same day I do PDO threads in the same treatment area. PDO threads, if you're doing a lifting PDO threads case, they have swelling from the procedure, and so you really want to give them appropriate time to heal. So I generally don't do any filler on a PDO lifting threads patient until about 4 to 6 weeks. That way all the swelling has resolved. We can see where the tissue is really, decided to lay, and then go from there. Now, if you're doing lifting threads and lips, like 2 different treatment areas, then certainly you can do them on the same visit. But hopefully that answers that question.
And we often do the smooth threads in conjunction with the lips fill. So that's one time that we will do smooth threads and filler at the same time.
Okay, do PDO threads build collagen? They promote collagen growth, so polydioxanone, the suture material, when it breaks down, it promotes neocollagenesis. It is the suture that's used in like an internal suture in a C-section or a tummy tuck. So it does promote that collagen growth, and that's why we're so crazy about it. We love our biostimulatories, and polydioxanone is a great one that we're incorporating in threads.
What's the difference between smooth and lifting threads? Excellent question. So the smooth threads are just like they're described, nice and smooth, just as big as a piece of hair or so. The lifting threads have little cuts or serrations into them that have then the lifting properties. So there's a few different ways to describe it. I think we all describe it a little differently. I like to explain the lifting threads almost like a piece of Velcro within the skin, because people get kind of confused. They think we're like using a thread to tie back their skin. That's not how it works. We use a cannula to get to the thread. Think of a straw and the thread, and we get into the tissue in the skin itself. Then we remove the straw or cannula. Then that thread has the serrations, and it's within the skin that we pull back. So then the skin stays in place as if it's like Velcroed in place. Can you guys describe it differently too, though?
I grew up on a farm, so I often say that the lifting thread is like a barbed wire, like a chicken wire. It has some barbs that grabs that tissue and is able to pull it backwards.
Yeah.
Yeah, so lifting threads we obviously use to lift. You also get that collagen production as well. And then the smooth threads are more for like rejuvenation of the skin, correcting textural issues and things of that nature.
Yeah.
So
I consider the smooth threads basically like just a very small piece of filler.
All right, last but not least, what are PDO threads made of? So hopefully you've been paying attention and you can tell us. PDO stands for polydioxanone. It is a dissolvable suture. And so, we hope you've learned a lot about PDO threads today. Please follow us on our YouTube channel, and we look forward to seeing you soon.
Make sure you subscribe. Thanks for tuning in.
Bye.